Healthcare is not just a privilege, but a fundamental human right, and yet only less than 5% of the population have access to affordable healthcare. You're welcome to the Red Room Dialogue, a show where we explore intricacies surrounding love, sex, relationship, marriage, and lifestyle. My name is Omobolawa Olawore, and I'm going to be your anchor on today's show. We'll be going on a short break. When we get back, I will be introducing our guests to you. Don't go anywhere, we'll be right back. Welcome back. This is still the Red Room Dialogue, and as always, I have my sidekick here with me, Petra Ude. Hi, girl. How are you doing?
I'm very well, thank you.
You see, I was going great minds think alike. I was going to say,
soul sisters,
always. And I have with me Dr. Darlington Amadi, a general practitioner in the Nigerian healthcare system. Welcome.
Thank you very much. Thank you for having me here today.
All right, so we're going to be discussing the healthcare system in Nigeria, the good, the bad, and the terrible. Dr. Amadi, I would want to give you your flowers, first of all, because I know that being a doctor in Nigeria is not easy at all. And this profession is such a noble one that I always want to give flowers whenever I see a doctor, because I know it's a lot to prove, a lot to do. You are giving so little, and you have to do so much. So every time, flowers. Do you have anything to say about?
Of course, to all the healthcare practitioners that stay 24/7 just to treat us, just to make sure that we are fine, we say a big thank you to you, and we hope that you continue the good work. So again, a big thank you. Thank you again, Dr. Amadi.
All right, so moving on very quickly, but not too fast. The bad, it's quite a lot. It is quite a lot.
I agree with you.
From negligence on the part of your colleagues and gross incompetence sometimes, it's just a lot. The negligence is too much because this is the kind of job that you are literally holding people's lives in your hands. Yeah. You cannot be nonchalant about it. It's something to be done very, very seriously. Are there systems in place to checkmate these things, run checks and balances? Or how does it work? Because the negligence is really, really astonishing.
It's over the roof.
Yes, actually, there are systems, there are healthcare systems in place in both government and private facilities to make sure that everybody that renders one service or the other is capable, qualified, and able to render that services at the highest and top-notch way or form. So, these things are there, but we cannot say how much of this system that is being used. In case somebody does something that they're not supposed to do or acts in a certain way, there's a system that's supposed to checkmate all this. But how well are this system used? That's the other thing that we cannot be certain about. But of course, there are systems in place to check both internally and externally. There are systems in place.
Well, I think aside the systems being in place, your character also has to be in check. I say it again, your character also have to be in check, because why would I go to a hospital, a general hospital at that, and I complained of something to the doctor just because I forgot to mention when I'm like, oh, I'm sorry, doctor, there's this other one. The matron told me, stand up and walk out. I was begging. I said, ma, please. And this was after I got to the hospital by 7:30 a.m. And the time the doctor attended me was like 4:30 p.m. So you can imagine the pain I was in when I was talking to that doctor. I couldn't remember everything that I came to the hospital for, but it was so terrible that I was almost crying that day. So it goes a long way. And this is not just a government hospital. It goes a long way, a very, very long way to say that your character also has to be in check, because you can't want to offer so much help and your character is zero.
I mean, the profession does require compassion, because this person is obviously in pain. Do you know that I absolutely refuse to go to public hospitals? Like, I am not going to go. I don't care how sick I am. I'm not going to go, because I know that they are going to add to my problems instead of solving it.
That's quite correct. I'm going to use myself as a typical example. You know, you have to have, just like she said, you have to have maximum character. Excellent one. So, I once worked at the airport clinic, and I had, met with a couple of patients, and the patient is coming back after a couple of weeks, and they are demanding that I want to see Dr. Darlington. Why is that? I might not have done so much, but the experience you had, it would have just been less than a few minutes to the doctor to just listen you out.
Yeah.
Or for the nurse, for the matron to say, okay, at most, if the doctor is busy, okay, what is it? Let me hear if I can help, or I can pass it to the doctor. Something to make you feel that you are being listened to and you are heard. Yeah. Because nobody goes to the hospital because they just want to go to the hospital. They actually have a problem.
Yeah.
That's why they are going to the hospital. You were stressed out already. So there's every chance that you must have forgotten something that is vital to your recovery and to what the doctor is going to do for you. And when you remember it, it might not have taken so much from them. But of course, there's no justification for any medical personnel acting out or acting in a wrong way. But like I would say, everybody should, especially in the medical practice, should, outside whatever is happening around their surrounding, bring in passion and bring in empathy, which is one of the major things that we preach, even while in medical study.
Yeah.
You must have empathy, you must have passion for it, and empathy for what the person, put yourself in that person's shoes, and how would you like to be. I have a slogan for myself: what I can't take, I would never give it out to somebody else. So that has also helped me a lot. So yes, there are medical practitioners that are, not very sound if it has to do with their character and how to exhibit their empathy. But that doesn't mean that it is out of the system. That is exactly how things are supposed to be done. So I would say strong apologies for that.
Yes,
thank you.
Strong apologies, Petra. There's also something to be said for like maternity wards, that you could be like 10. How many centimeters are you supposed to be dilated before you give birth? I think 10.
Yes.
You could be like 7 centimeters dilated, and you need urgent medical care because obviously you're in pain, you're having contractions. And then the matrons are just like, whoa, you did not bring needle or something inconsequential. Like, you're literally in pain and you're just very nonchalant. Again, to new mothers that like, this person needs help. They need to be attended to. They need to be comforted and everything. And you're just very, no, don't worry, just stay there. There was someone that wanted to give birth, and I think she was coming from an event or something, and she had makeup on. And then she got there, and the matrons were like, oh, yes, yeah, you still have makeup on. You're not ready now. You're not ready. When you're in pain very well, you will see. You will see very, like, they just dismiss their pain. And that, you can't be that dismissive when you are a doctor or you are supposed to provide help. Your job is literally to render help.
Individuals have their, I might not have known what might be the contributing factor for why anybody, especially in the healthcare system, would, trivialize, no matter how little that complaint is. It could be that little complaint that might be the major problem the person is having.
Yes. Yes, actually.
Yes, so maybe the medical practitioner might be, oh, this thing is so little, it doesn't mean. But it could be actually the little problem, it could be the most problem the person is having, right? And sometimes even just the way you interact, you might not do so much for somebody, but the way you talk to them, the way you let them know that I understand what you're going through.
Yeah.
Maybe there might be reasons why that patient is not being attended to at that time. But the way you relate with the person might not even realize that they're not doing anything for me, but I'm actually feeling slightly better.
Yeah.
The pain might not have gone away, but the way the person must have responded, oh, sorry, just show some sort of empathy and care. But like I said, every medical practitioner is supposed to have that at the back of their mind, that no matter what it is, what you are interested in is to make sure this person gets better. So the most little thing, the most trivial thing can be what would help the person. Now imagine just telling somebody, oh, the nurse knows that you can't get into the labor room with makeup on. What's this doctor say? Oh, your makeup is still on. Take a wipe and clean it off. So just little things can actually go a long way. But like I said, I will always say it's an individual thing, and we hope that more of our medical practitioners will begin to come to terms that you don't really need to do so much, right? Outside your knowledge, your medical knowledge, and what you know, you could just be a simply nice person.
All right, let's look at the private sector. You look at the private sector, and most people, they try to get insurance. We all know that the NHIS is not very functional in Nigeria that well, so people just try to get their own insurance. But let's talk about like private hospitals, that they will attend to you. Like the problem you have in the public hospitals is that they probably won't attend to you very fast.
Yeah.
The private hospitals will attend to you very fast, but they will probably have you doing like series of tests, like just series of tests that probably you do not need. Probably because they want you to spend more money or something like that. And their care is not, I don't want to say it outright, but their care is not like at the public hospital, you probably get more for less. A more thorough,
Yes,
but in the private hospitals, it's a risk. I also said that she was treated like very badly at public hospitals. Like they were rude to her, they were cruel, wicked, but she would take it over the private hospital, because the private hospitals are not that good. Their doctors are very, I don't know, maybe because they are privately owned, their care is not exactly as strong as the one in the public hospitals. Like the public hospitals, you could give them like less. Maybe there's no light, they have to use the generator, but they'll get the job well done. But the public hospitals, you cannot guarantee.
There's a comparison I'm going to make between private and public facilities. And I'm going to bring it to funding. Private facilities are funded by maybe the owner or a group of people or shareholders. Yes. So they are putting in money. It's like an investment. And what do they want in return? Profit. The tail end of whatever happens in that hospital is that we would eventually make profit, right? For public hospitals, really no room for profit making. Yes, it could be funded by the government, but it could be underfunded by the government, not as much as it's supposed to be. But nobody is thinking that, we would tell the patient to run more tests because we're going to be looking at making more profit. No. Whatever they are doing for you is what they have at the time. Their own government facilities will do what is available at their disposal. Private hospitals have the resources to make everything available. So they can want to utilize the fact that they have that capacity and make it. Now, let me look at testing. Running a test for a patient, the doctor will recommend any kind of test after speaking with the patient, understanding what the patient is saying, and then he's saying, okay, from what you're saying, I think we should check for this, so that we can streamline what is wrong with you and get to the root cause of the problem and then solve it. Now, just like sometimes they might recommend tests that you don't need. It might also be boiling down to they want to make profit. The doctor knows what he's looking out for. The doctor also knows what the testing is before he sends you out for it. So that could be a contributing factor. But
should they not look out for functionality, like be quick and also functional.
Yeah.
Should they not look out for that too?
You should actually. You should.
Interesting.
Well, I think there's also an issue of wrong prescription in the private hospital. And this happened to a pregnant woman that I know of, or once pregnant woman that I know of. She went to the hospital and the medication she was given is something that could bring out her,
Cause harm.
Yeah, cause harm to her already 7 month old pregnancy, 7 to 8 months old pregnancy. Okay. So what would you call that? I don't know if negligence is the right thing to say, and if it's negligence, why in the world would a doctor, a medical practitioner, someone that went to school, that did housemanship, come and administer a drug that would abort a pregnancy? And then they called later and was saying, "Oh, madam, we're
like
sorry.
It's a silly mistake, like you broke a cup or something."
Yeah, you get that kind
like
of thing. So why would that even happen in the first place?
I cannot give a reason why doctor. One, maybe I can say how grounded professionally is that doctor. First of all, I could if I'm going to sit in a panel, let's say that is an issue, and the doctor is sitting in front of me, I want to understand how grounded professionally that doctor is, because you should know that this medication is definitely going to be harmful for somebody that is pregnant, right? And you shouldn't be doing that. So,
and it was a private hospital, so you could not say that they are overworked.
Now that also boils down to the management of the hospital. What are the checks that they did to be sure that this doctor that is going to be attending to people is, knows what he or she is doing?
This conversation is certainly interesting. We're going to be taking a short break. When we get back, we'll be looking at the government policies towards the health sector in the past few years. Don't go anywhere. We'll be right back. Welcome back. This is still the Red Room Dialogue, and we're still talking about the Nigerian healthcare system, the good, the bad, and the terrible. I say that with us, Dr. Darlington Amadi and Petra Ude. All right, so we're going to be talking about the brain drain. Doctors are leaving the country at alarming rates. And the Nigerian government tried to combat this by trying to make a law, that doctors have to practice in Nigeria for 5 years before they leave. What are your thoughts on this?
Okay, I'll start with, the standard of doctor to patient, right? I'm certain that in Nigeria, one doctor is to maybe 50 to 200 patients.
Yes.
That's a lot, actually. That's actually a lot. That could cause a lot of, mental and physical fatigue on the doctor. And then also, just like we started with, all the works that medical practitioners do in this country and how much, they are being appreciated. What's the motivation? Everybody, you can have passion for something, but you also need to put food on your table, right?
Sure.
So you need something outside your passion that is also going to be a fueling encouragement.
Incentives
for you to, keep doing that thing that you love and know how to do best, right? And in Nigeria, that is not really very good. So imagine a doctor that knows that, I can still do what I'm doing passionately and then make good money out of it somewhere else. And you tell the person not to go there.
I actually understand them. I understand where they are coming from. But at the same time, we need to look at it because the Nigerian government tries to subsidize education. So they subsidize education, like for an average adult that is trying to become a doctor. Taxpayers' money, in Nigeria, education is really cheap. Yes. Really, really cheap compared to other countries. And they subsidize your education, and then you finally grow up. And the minute you're done, how many years is your housemanship?
Is it a year?
A year, just one single year. And the minute you're done, housemanship, NYSC, you carry your bag and you leave. We are losing resources. Those are resources.
Yeah.
Those are resources. We're losing resources. So leaving as soon as you are able to is, I understand that they need incentives, but it's somehow wrong.
I would say that also brings us to, the country's healthcare system, structure of the country's healthcare system. So a doctor that graduates, knowing that they might not get a job immediately they graduate. You know that, right?
True.
But I don't think doctors have that problem in Nigeria.
Yes, actually.
They do.
Oh, they do.
Yes.
You see doctors driving Okada.
So
Yes.
So employment for medical practitioners is not a guarantee, it's not certain that as you graduate out of the university and then you're able to practice, you're going to get a job. Also, you see doctors working in 2-3 places. What is the reason? Because they know that working in just one place might not provide all the needs that So they would rather have, one shift in other places, and that could turn out to be a lot of stress, mentally and physically, on the doctor. But when the doctor hears or gets to find out that I can work in one place and my time is utilized appropriately. I have time for myself, I have time for work, and I'm going to get properly appreciated financially and otherwise when I do what I know how to do best. They want to go there. Our system does not also guarantee doctors' safety or immunity in any workplace. There's no guarantee that you get a job now and you will be there for another 5 years. Right?
Interesting.
There's no guarantee to that. Whether private or public.
Yeah.
There's no 100% guarantee. But I'm sure in the Western world, if you get into the system, except you decide that you want to move. Sometimes, in the UK, sometimes they make you sign a contract that you would have to work for us for a certain number of years.
Because they are so in demand.
Exactly.
Yeah. Well, I actually agree with everything you said. And I want to specifically speak on the financial aspect. Doctors are not being taken care of, or they're not properly taken care of. Their welfare system is trash. If I am permitted to use that word, it is trash. Because tell me why I'm a doctor working in the government parastatal in the government hospital, and I'm earning less than 100K, and I will be in attendance in the morning. You will need me in the evening, I will be there, and you're giving free. The motivation to work would not be there. It won't be there. And that's why, again, people would always want to look for greener pastures. Because if, for example, there is no enough, like you said, to cater for their needs, they would always want to move out. Always want to move out. Aside the fact, and it's not just in government hospital,
yes,
right? Even the private. So I don't know where you work, but give an average of a maybe the basic salary of probably a nurse in a hospital.
A nurse, the highest a nurse can get paid if the hospital is private. Let me start with private.
Please do.
If the hospital is willing to do really good, could be around between 80 to 150,000. It is 80,000 to 150,000. And a doctor, you will see between 200 to maybe 300,000 maximum.
I am short of what?
Government facility, they start up a doctor's salary with 180. Now I hear it's 200,000. They start up the nurses with 80. It used to be 80. Now here is 100,000. So.
Interesting. Let's look at the infrastructures in these hospitals. Because you go to a public hospital and their bathrooms are streaked with blood. Like, it is so messy. Like, you don't want to spend a second there. I think it was around last year that a young doctor, like, I think she was doing her NYC or something, and she got into the elevator. I've forgotten what part of the country. I think it was Lagos. Yes. She got into the elevator, and then the elevator failed, and she died immediately. And will you believe that the government has still not fixed that elevator as we speak
till date?
And I think that really shows like what we are going through. In like we say, the budget for healthcare is less than 4%, but in reality, it's even worse. Because there was so much attention on this issue when it happened. Like, she was really young.
It was loud. The media carried it. It was very loud.
Because she was really young. And for them to, the negligence on the government part to have not fixed it till date, it speaks to a larger issue, actually. It actually speaks to a larger issue. because it's not funny at all.
So you see, people run to private sector because, you get in there, the reception is looking amazing. The waiting area is looking really good. Because actually, somebody is coming in distress. You have to put them in a space where somehow that stress is out.
Exactly.
So you don't go in and then you're putting somebody in a waiting area where it's adding to their stress. Our public facilities, I'm sure when those facilities were set up, they were looking amazing. Right? It's the very poor maintenance factor that we have in the country. You have to keep, as the year goes by, things are changing. You upgrade, you up your game. How can a hospital that has an elevator do not do regular maintenance? Because I'm sure if there's a regular maintenance on that elevator, it wouldn't have actually failed in the way it did, and then costing the life of a doctor. So let's even look at it. What if she was the only one in that elevator at the time? What if there were
the story was
patients,
incredibly sad.
I cried.
What if there were other people, other staffs, other visitors of the hospital? It wouldn't have just been one life we will be talking about.
Lots.
Multiple
Yeah,
lives.
I think that even one life is one too many.
Yeah,
Of course.
true.
We need to like value. I think that Nigeria does that they don't really like value people's lives, and it's quite sad actually.
Yeah.
The health sector in Nigeria, it just leaves a lot, like a bad taste.
Yeah,
like,
it leaves a
it
lot.
does.
It leaves
there are so many
Yeah.
holes in
Yes.
like I had a story once that someone said that she was pregnant and then she went to the hospital. This was even a private hospital, by the way. And I think that she got there. She had been there 2 days prior to the day, and then they said, she was ready. She was already dilated and she needed to have the child. And I think they just decided that the child was breached and they needed to have like a C-section immediately. And you know how Nigeria works. If there's no money, they are not, like, you could die. They don't care. You could die. They don't care at all.
That also brings me to a lot of patients in Nigeria do not know that they have the right to know every fucking thing that happens to them from the beginning till the end. I mean, from the beginning, a doctor says, I'm going to give you paracetamol. What is that paracetamol for? Why are you giving it to me? What did you find out?
I don't think that people know this.
That made you say, I need to take paracetamol. So, in as much as doctors and nurses, we are here to make you feel better, we should also educate the patient on what they are being done, what is done for them to make them feel better.
Doctors, I think that you are speaking from a very biased point of view, because I don't think any doctor is going to stay and give you a detailed reason why he's doing anything.
Personally, I do that a lot. Somehow, some people, I take it like what we call medical education, right? I'm running a test. I'm telling you, I want to run a test for you. I'm going to explain to you why
It's for.
I am running that test. And it's going to be coming from what you have told me. I'll say, because of you said this and you said this, I want to run this test because I'm suspecting A, B, C. So, a lot of patients, a lot of us, we just go to the hospital and just sit down and the doctor bamboos you with everything and then you walk away.
Because they are not very, I don't know.
You have the right to know every fucking thing that is done for you.
Speaking of rights.
Ask everything. No.
Yeah.
Some doctors will tell you that, when you explain too much to the patient, they don't want to come tomorrow, they want to do it at home. No, not at all.
So you realize that your colleagues do that?
Oh, yes. Some doctors will
At least he's sincere.
argue that, there are some things you don't need to tell. Like, it's information, it's education. I realize that when you educate a patient, that is when the patient wants to come back, because they know that everything that you're doing for them, they are aware and they understand it. I go as far as explaining, using the most layman's terms to explain whatever it is I want to do for anybody. Because I want you to because when you're recovering, you understand why you are recovering. If you know what is done, what is being done to you or for you, your process of recovery, you will understand that, this is why I'm recovering, because the doctor has done this, because this has been done.
XYZ.
So you understand why that medication that was given to you, as you're taking it, you're recovering. And also helps with adherence too, what we call medical adherence. If the patient knows that if I have to take this medication like this, and this is what the result is going to be, they will be encouraged to want to take the medication and get better.
Interesting.
Sorry, before you go, Bola, speaking of rights, just quickly tell us, what are my rights as, a
Patient?
In a hospital?
I can't really state every of the rights, but a patient, let me just list a few of them. A patient has the right to know even to the medication, tablets, injections, whatever it is that is being administered to the patient. The patient has the right to know what it is for, and why it is being given to that patient. The patient has the right to ask and know that. I'm certain that no doctor would want to cut you short when you ask that, this medication you're giving to me, what is it going to do? What is it? And how will you be helpful to me? The patient has the right to testing. The patient has the right to know what the test is for and why you are also recommending that test as well. So these are just a few, but like I said, a patient has the right to know everything that pertains their treatment plan. We call it treatment plan from the beginning till the end. Shout out to the patient that asks, what are you doing for me? Why are you doing this for me?
They might in the public hospital. They might.
Don't remind me of my terrible experience.
I can understand, shortage of staffs and manpower can make
they have zero patients.
Want to quickly get done with you because they have a long list of
people to attend to.
That can also be.
All right, doctor. We've come to the end of the show. Do you have any last words for people out there? Things they need to know, to look out for?
Advice: I would encourage everybody to, always be conscious of their health, and if you feel any kind of way, reach out to your either personal or maybe private doctor or walk into any facility to make sure that your health. They say health is wealth. So when you're healthy, you can do anything you want to do.
Yeah. Thank you so much, Dr. Darlington, and thank you for coming on the show. It was really nice to have you. To my ever beautiful sidekick, it was really nice to have you here with me too.
You're welcome.
All right, we've come to the end of the show. Thank you for watching, and I'll be signing out. My name is Omobolawa Olabare. Bye for now.
In for a beautiful ride in the red room. All your doubts and fear we cater to. We dot all the I's, cross all the T's. That's what we're here to do. Yeah, we'll take you on a journey. Everybody, let's go. You're gonna see him.